The Seniors Health Insurance Information Program, or SHIIP, is a division of the North Carolina Department of Insurance, and we assist people with questions on Medicare and Medicare products like Medicare supplement plans, Medicare prescription drug plans, Medicare Advantage plans, and we also answer questions on long-term care insurance. We do have a SHIIP call center, as Jasmine mentioned. It's located here in Raleigh, and we have representatives available Monday through Friday from 8 a.m. to 5 p.m. to answer questions that come through the toll-free line. It's important to know when you're calling that number, it is a rare occurrence in this day and age, but you actually get to speak to a live person, which is wonderful, so folks aren't having to navigate through an automated system. The type of information a person would need when calling the SHIIP call center is really going to be dependent on the reason for their call. If it's a situation where there's a question on a Medicare claim, it might be a good idea to have that Medicare summary notice available when calling. If someone is looking for help in choosing a Medicare prescription drug plan, a list of the prescriptions they take on a regular basis with the strength of that medication and how many times a day they take it and the quantity would be extremely helpful. And most of all, probably just having that Medicare red, white, and blue card available would be extremely helpful in case the SHIIP representative needs some information off of that.
Okay, and Mr. Mowbray, could you tell us about some of the outreach events that you have?
Yes, we are focused most of all on letting people know that we exist. I mean, to take advantage of our services, you need to know how to contact us and know that we're available not only through the call center, as Melinda mentioned, but also we are in every county in the state. We actually have volunteers and coordinators that exist physically in each county in North Carolina. So our outreach is focused on letting people know where we are and know, as Melinda mentioned, what we do. And we also work a lot with other agencies. It is very important for us, for other agencies to know what we do so that they can refer people to us appropriately, and by the same token, we can refer to them.
Which would be some of the agencies
we work with the Department of Social Services,
okay,
Social Security Administration, agencies on aging, councils on aging, senior centers. We are located mostly in senior centers, cooperative extension offices, maybe in the east a lot, but we virtually work with any agency that works with seniors or with Medicare beneficiaries. That's one thing we are, although the seniors is in our name, we are focused on serving the Medicare beneficiary, not just seniors.
Okay, because there might be other people who are not seniors yet, but they're still under Medicare.
Absolutely. There are a number of Medicare beneficiaries who have been deemed disabled by the Social Security Administration. Individuals that have been diagnosed with Lou Gehrig's disease, ALS, or individuals that have what's considered end-stage renal disease would also be eligible for Medicare.